In your Eye on Health tonight, we are live talking measles again. We know the cases are still spreading across Texas, and tomorrow we're actually getting another update on the exact number of cases from the state. But tonight, we've got an expert with us. You've seen Dr. Jennifer Moriera before. Baylor Scott White is here to talk about the latest outbreak. The first thing I want to ask you is we are seeing more people become infected with the virus. Yes, most of the cases are still to the west of us, although we have had some folks that have been infected in our area. First thing we should do when we hear that we've been in a space with someone who's infected with the measles.
Yeah, so yes, unfortunately, the number of cases have gone up because the virus is very contagious.
Yeah.
So first off, symptoms to look out for. So fever, cough, runny nose, red eyes, followed by a rash that starts on your head and moves its way down to the body. That is signs of measles. So if you or a loved one suspect you may have it, we recommend you call your local doctor's office to get more information on where to get tested. Try to avoid going in person to the doctor's office or the ER. That way we can prevent it from spreading to others.
I'm glad you said that because that might be someone's first instinct, you know, call first, right? By your count, current number of folks infected here in Texas?
Yeah, currently, as of right now that we know of, we have approximately 597 cases of measles just here alone in Texas.
Yeah. Okay, so whether I'm vaccinated or not, what should people be doing and how long do those symptoms last? I don't think we've talked about the duration.
Yeah. So if you are uncertain about your vaccine status, step one, ask for your immunization record. If you don't have access to it or you don't see it listed on there, the next step would be to consider going to a local lab, getting a blood test to see check your immunity status. In other words, if you are unvaccinated and you know you have been exposed to someone with measles, typically symptoms will present 7 to 14 days after exposure, and they can last up to 10 to 14 days.
Okay.
And if someone does have measles, they tend to be infectious 4 days prior to symptom onset and up to 4 days after the rash.
Okay, really good time. Really good to distinguish the timeline there. Last thing I want to ask you is about pregnant women. You know, they're more vulnerable anyway, but as a family medicine doctor, what's your stance on whether or not pregnant women should be getting the vaccine? Yeah,
so per CDC guidelines and recommendations, we recommend that pregnant females do not get the MMR vaccine because it is a live vaccine and the fetus, its immune system is still underdeveloped. However, the CDC does recommend that for most children around 12 months that they get their vaccine because at that stage their immune system is more developed, it's strong enough to tolerate that weakened virus that's found in the vaccine while still getting the benefit of lifelong protection.
Is there anything I can do if I'm an expectant mom and I have been exposed or I'm fearful that I will be exposed that I can do since I can't take the vaccine?
Yeah, so what you can do, one, whenever you're out in public, please wear a mask because the way it's transmitted is via droplets that can stay in the air up to 2 hours. Try to minimize your travel if you can. Try to not visit maybe doctor's offices if you don't need to or ER departments if not necessary, but wearing a mask can go a long way in that setting and just avoiding anybody who's sick.
We're used to that, aren't we? Masks, COVID brings you back. Dr. Moriera, thank you so much for being with us. Some good information as we still navigate the measles outbreak.